Hi, and welcome to the Breastfeeding Medicine Podcast. I'm your co-host, Dr. Ann Eglash. I'm a clinical professor in the Department of Family Medicine at the University of Wisconsin School of Medicine and Public Health and a board-certified lactation consultant. This podcast is produced by the Institute for the Advancement of Breastfeeding and Lactation Education and is co-sponsored by the Academy of Breastfeeding Medicine.
Hi, Karen. How are you?
I'm good, Anne. It's so good to hear your voice.
It's good to hear from you too. Yeah, it feels like, we're all alone in our homes, but then yet together on Zoom, which is not existence right now.
Yeah.
Yeah, so your family's doing okay?
Yeah, we are. We're getting used to this new situation.
Yeah, I think summertime really helps, just being able to get out. I dread this in January if we're still inside all the time.
Yeah, I was really, really happy when school ended because trying to balance the online school was really hard. I've enjoyed summer. Going back is making me a little nauseous.
Yeah. How are things at the hospital with COVID?
Well, they're a little better. I think we have sort of gotten in the swing of things, gotten a lot more of our processes down. We have been pretty busy. So, we have more than 10,000 deliveries a year at my hospital. And we've seen a little over 160 moms who have delivered who were positive for COVID at the time of delivery. And I would say at the peak, we had around 6 a day, and now we're down to more like 2 moms a day. They're doing universal screening. So almost all of them are asymptomatic. And now we're also seeing a group of moms who were positive for COVID during their pregnancy, but have since recovered.
Great, very nice. And so what about readmissions of infants who want to COVID positive mothers?
We have not really seen babies who were, newborns breastfeeding who have contracted COVID. There were a few babies early on who came in with fever or poor feeding who were found to have COVID while they were being worked up for their, to see if they had sepsis as the cause of their symptoms. But those babies weren't very ill and they were able to go home after the 48-hour time period that we watch them to make sure they don't have bacterial infection. And really, we haven't seen a lot of infants who are in the hospital.
Mm-hmm. And what about the older children?
We did see a fair number of kids with COVID, some of whom were very ill in the ICU, and a couple who were on ECMO. And happily, they have all recovered and gone home. We have also seen some kids with that multisystem inflammatory syndrome, and we continue to see those.
Interesting, yeah. Well, hopefully that will not all increase with school in session in some parts of the country.
Yeah, there's so much that's unknown.
Yeah. So I guess we'll turn our attention from COVID to some more interesting things regarding breastfeeding. And you have a couple articles for us.
I do. There were 2 articles that were back to back in the journal Breastfeeding Medicine in July of 2020 this year. And they really seem to relate to each other in my mind. And so I wanted to go over those 2. The first is, are low-income diverse mothers able to meet breastfeeding intentions after 2 months of breastfeeding, by Kay, Cholera, Flower, and other authors. In this article, the authors describe the association between intended and actual breastfeeding duration among low-income diverse mothers who reported maintaining breastfeeding for the first 2 months postpartum. And I thought this was so interesting because a lot of articles that look at intention really, we go on to see that they compare that to how breastfeeding is going later, but there's a certain number of moms who are not successful, and it, in a way, skews the data. So these authors included mothers who were 64% Hispanic and 17% non-Hispanic Black, who were participating in Greenlight, a cluster randomized childhood obesity prevention trial, who were providing breast milk at the 2-month well-child visit and reported intending breastfeed duration at that visit. Breastfeeding status was assessed at subsequent well-child visits up to 24 months. The authors also compared race, ethnicity, income, receiving WIC benefits, education, age, employment, depression, maternal obesity, whether they were born in the US, whether an infant was first born, and which study site they were seen at. They discovered that the median intended breastfeeding duration was 11.5 months, and the median actual breastfeeding duration was 8.6 months. They found that 49% met intended breastfeeding duration. Breastfeeding duration differed based on milk type provided at the 2-month visit, in that mothers who were providing mostly or only breast milk had increased likelihood of meeting breastfeeding intentions. Regardless of milk type provided at 2 months, the longer a mother intended to breastfeed, the less likely she was to meet her intentions. And so they concluded that in this diverse sample of women, less than half met their intentions despite maintaining breastfeeding for 2 months. And they said understanding factors that prevent mothers from attaining intended breastfeeding duration is critical to improving outcomes, especially in low-income and ethnic minority populations. So when you dig in a little bit deeper, the authors remind us that breastfeeding duration has increased in recent years, with 57% of babies born in 2016 breastfeeding at 6 months and 36% at 12 months. But the rates among non-Hispanic Black women are consistently lower, and fewer low-income women continue breastfeeding compared with those of higher incomes. Prenatal breastfeeding intentions are strongly associated with breastfeeding duration. However, they can change postnatally, and many mothers who initiate breastfeeding stop earlier than planned, as we all know. Poor initial experiences, particularly in the first 2 months, are a strong predictor of early breastfeeding cessation. However, beyond 2 months, breastfeeding intentions and rates after initial initiation are not well understood. And understanding whether women who continue providing breast milk beyond that early time frame attain their intended breastfeeding duration is important to determine and assess barriers to sustaining breastfeeding, particularly after mothers return to work. So when they were examining duration, which was the primary outcome measure of the study, they looked at these well-child checks, which, based on the AAP and, I lost it there. When they were looking at breastfeeding duration, the primary outcome of the study, they looked at all of the well visits, and mothers were asked what type of milk their child was receiving. The responses included formula only, mostly formula and some breast milk, equal amounts of breast milk and formula, mostly breast milk, but some formula and breast milk only. And then a second outcome was whether intended breastfeeding duration was attained. There were 375 mothers in this study.
Oh, that's a large study.
Mm-hmm. And the results were that at the 2-month visit, over a third of the mothers were exclusively breastfeeding. 38% more were providing mostly breast milk. Only 2% were providing equal amounts. And then 26% said that they were providing mostly formula. Most of these mothers were Hispanic, like I said, 64%. And over half were from households earning less than $20,000 a year. They had a quarter had less than a high school education, a third had obesity, 80% were receiving WIC benefits, and 14% screened positive for depression at the 2-month visit. Mm-hmm. Over 2/3 of their participants were not born in the United States, and over a third, 38%, were the firstborn. There were no significant sociodemographic differences associated at the 2-month visit in the type of milk provided. So really diverse, interesting population, and sort of all doing around the same at that 2-month visit. So when they looked at their intended breastfeeding duration, the mean intended duration was 11.5 months, and the intended breastfeeding duration varied by the mother's age, with younger mothers having shorter intention. The duration also varied by level of education, with high school graduates reporting shorter intended durations compared with those with less than high school or those with some college. And mothers who had their firstborn child also reported shorter intention. When it came to the actual breastfeeding duration, the median was 8.6 months. Mothers providing mostly formula breastfed for the shortest duration, and that doesn't surprise me. That's usually what we see in most studies.
Yeah, that makes the most sense.
Yeah. And when we look at intended and actual breastfeeding duration by milk type, this is, I think, when I look at a lot of these studies, it's both like, oh, that's interesting. And a lot of times it's like, oh yeah, that's totally what I see, right? Like, this is not surprising.
Yeah.
So mothers providing mostly formula or equal amounts of breast milk and formula reported shorter intended breastfeeding durations. And they have this interesting chart, which has essentially 4 sections. You've got mothers who are exclusively breastfeeding, mostly breast milk, equal parts, and then mostly formula. And each section has 2 bars. It's a bar graph, the intended duration and the actual duration. And one of the things I found so interesting about this was, when you look at the intended breastfeeding duration, those moms who are exclusively or mostly giving breast milk, the bar is at 12 months. And when you look at the intention for the moms who are mostly formula feeding or giving equal amounts, the intention is 6 months.
Mm-hmm.
And I think that that says a lot about what the messages that women are hearing, right? Like, this is what they've been told to do, and so that's their plan. And moms who know that, they're not giving a lot of breast milk aren't going to say, I'm going to breastfeed for 12 months, because they don't, like, it's not going that well. I guess it's a chicken and egg question, right? Like, partly I find that a lot of patients that I see in clinic, when breastfeeding's going really badly, they keep adjusting their intention downward. Like,
Yes.
I intended to exclusively breastfeed for 12 months, but now I'm pumping drops. Let's see if I can pump for a month. Like, trying to, pull some small win out of what's a really tough situation.
Yeah.
So like I said, the intentions were 12 months and 6 months, depending on how things were going. And then the actual achieved duration for moms who were exclusively breastfeeding was 11.5 months. For those who are giving most breast milk was a little bit over 10 months. For those giving equal parts breast milk and formula, it was a little over 3 months. And for those giving mostly formula, it was 4 months.
Mm-hmm.
So about half of the mothers met their breastfeeding intention. And among mothers providing only breast milk at 2 months, 60% met their intention, compared with 52% of those providing mostly breast milk, and in the 30s for both of the groups that had a lot of formula. In the unadjusted model, the likelihood of meeting breastfeeding intentions decreased depending on the amount of breast milk provided at the first 2 months. And so the authors point out that despite overcoming the barriers to initiating and maintaining breastfeeding in the early postpartum period, half of the mothers in this group still did not breastfeed as long as they intended. Mm-hmm. In addition, the more breast milk the mother provided at 2 months, the more likely she was to meet her intentions. But still, those who were exclusively breastfeeding, only 60% were able to meet their intention. And other studies have demonstrated that when measured prenatally, positive intention and attitude toward breastfeeding is associated with better breastfeeding initiation, but few have assessed how intention influences duration, particularly past 6 months. And measuring breastfeeding intentions among women who have already established breastfeeding can have more practical experience. And so one of the things that I thought was really interesting was they went on to say that DiGirolamo, who has done some really interesting studies in this area, highlighted the importance of including initial breastfeeding experiences when assessing maintenance of breastfeeding duration. For women with negative initial experiences with breastfeeding, they're less likely to continue. And in combination with this results shows that mothers with longer postnatal breastfeeding intentions, for those mothers, meeting those expectations is more difficult. And they then said, suggesting mothers may need increased support throughout the postpartum period to attain their breastfeeding goals.
No, which is like so clearly like that's what we see every day, right?
Yeah, and then they say many mothers may not anticipate the challenges associated with sustaining breastfeeding, leaving them ill-equipped to overcome them.
Yeah. Well, you and I probably, I mean, I hear this all the time. I'm sure you do too. Women say, if only someone had talked about this issue, like the possibility of not having enough milk, I wouldn't be so, I wouldn't have been so blind going into this and not understanding why my baby got readmitted for dehydration. I mean, we do talk about, that most women can do well, right? And we assume most women can make sufficient milk, but there are so many mountains to climb and so many booby traps, and there's so many issues that come up, and every woman's different, that so many women feel frustrated that they did not anticipate these problems. And so it totally revises their own expectations after, for those first couple of weeks.
Well, yeah. And so then, the authors go on and they talk about the support needed to sustain breastfeeding comes from many places: health providers, family and friends, partners, blah, blah, blah. And then they say social support, an important modifiable factor, could explain mothers' inability to meet expectations. Future studies would benefit from determining the presence of social support and its effects on meeting breastfeeding intentions. And this is where I lost my mind, because I was like, moms who have succeeded in breastfeeding for 2 months, meaning those ones who were exclusively breastfeeding or were mostly breastfeeding, the difference, I think, I mean, this is just my clinical experience, between the 60% that met their intention and those that did not, is not social support. There are factors that determine whether or not moms wean early later on, and it partly has to do with return to work, but a lot of those people that wean early, it's really because if they've already succeeded past 2 months, they've probably had most of the early pain problems resolved.
Yeah.
And later on they struggle with supply, or they hit a bump in the road that they weren't expecting. And there are so many. I mean, I have patients come to my breastfeeding clinic who are have 9-month-old babies who never had a problem. And then they got, bit, and they have a wound that won't heal. Or then they got the baby yanked because they wanted more flow and caused a bleb. And then that, caused intense pain. And then, so there are like all these little medical things that happen later that anybody who comes to see me has probably gone somewhere else first, and they went and they found people who didn't know what to do.
Yeah. Yeah. So what you're saying is that these are problems that go beyond social support.
Yes, that is what I'm saying. I'm saying there are medical problems which are not being addressed in our system. And so suggesting that it's a problem with intention or social support really, I think, is abdicating responsibility of the healthcare system to look at why women who, wanted to breastfeed a year aren't making it there in large numbers.
Yeah. And I think, the infant feeding 2 study, one of those looked at reasons for weaning early, and a low milk supply is, a top one. And I think there are some social issues connected with low milk supply, though. There are the issues of the partner not wanting mom to feed in public, or not having financial resources to get a really decent pump. Like I had a mom like that recently. She couldn't afford a pump and she went back to work. So she thought that she could get by with, 12 hours of working without a pump, and could just come home and just nurse for the next 12 hours.
I don't think I'd call that social support, though. I mean, that's a system problem. But when I think of social support in the way that I think that was more like the mom's circle, right? Like her family and friends and
Oh, yeah. But I think part of it is like, I think what happened for her is like her partner chose the pump and it chose a pump that was really lousy. And she didn't have much say over it and it wasn't what she wanted and it didn't work right. And then like her partner didn't help to troubleshoot it to figure out like what's wrong with the pump. And so, there's, and then lack of education, right? So not understanding like the fact that if you go for 12 hours, you're going to drop your supply.
oh yeah. I mean, that to me is the biggest thing that I see with people who have struggled and struggled. And so, I think in addition to saying people's intention was for 6 months or 12 months, there are people who had a like strong intention and there are people who had a weaker intention, right? Like I really want to breastfeed versus, I'll try.
Mhm.
And I think there are people who, they tried and tried and tried and they did various things. And often they say to me, if only I had known.
Yeah,
Like they have learned so much because breastfeeding is not simple when it's not going well. When it's going well and, mom's with her baby and she doesn't have to worry about the pump and there's no pain, it's a self-sustaining system, it works great. But when it's not working great, understanding how to fix it is actually can be pretty complex.
really complex, absolutely.
And there's not good, knowledge in our communities or even our primary care of our health to help set moms back on course. And so they're trying to figure it out on the internet. And then, things didn't go that well. And often I have this conversation with moms, and this will lead us into our next article, which is perfect, which is you have learned so many things. When you have another baby, things will be different because
Yes,
you know where those booby traps are and you're not going to fall into them again.
exactly. And this is where I think sometimes like the maternal education and financial resources um, lead to that difference in breastfeeding duration because a woman who has more money can find a private lactation consultant. She maybe is more able, if she's more highly educated, to surf the internet. Um, Someone who may have a little more time because she's not working on the clock to check in on her Facebook social support group to get some ideas. So there's
Oh,
so
yeah, absolutely. I mean, the other thing I didn't get to in this article was the author said unique cultural factors may have affected mothers' abilities to meet expectations, as over 3/4 of the mothers in the study were Hispanic or non-Hispanic Black, and many were not born in the United States, and nearly half spoke primarily Spanish. Culturally specific factors that may affect breastfeeding among racial ethnic minority women include a cultural literacy, cultural acceptance, support. And they talk a little bit about the idea that, and this is a thing we talk about a lot in the United States, our Hispanic populations are more likely to dual feed and start, early formula supplementation. But I think that particularly in the time we're in today, rather than just looking at the cultural factors, looking at that support and the fact that our minority populations do not have equal access and support.
right, yeah, in many realms, right,
Mm-hmm.
exactly, because of the language barrier and then also healthcare. Absolutely, yeah, yeah, very interesting. Yeah, I do think I like the fact that one of the comments that you made about not measuring the intention just by prenatal intention, but measuring also like taking into account their intentions after they have their initial experiences breastfeeding,
Mm-hmm.
because people definitely readjust their intentions after they give birth, depending on how things go, including mothers who like they weren't even sure they were going to breastfeed and thought they had an intention of like, oh, maybe 2 or 3 months until I go back to work. And then suddenly they realize this baby loves to feed and this is super easy and I don't have to clean bottles and this is great and I'm just going to keep doing this because it's,
Absolutely.
yeah, right.
Yeah. All right. So the second article is titled Parity and the Association Between Maternal Sociodemographic Characteristics and Breastfeeding by Buckman, Diaz, Tuman, and Baer. And In this study, the authors note that breastfeeding initiation rates differ by characteristics such as race, ethnicity, age at first birth, and educational attainment. They hypothesize that the strong influence of prior infant breastfeeding experiences on multiparous women's decision to initiate and continue breastfeeding may mean that these maternal characteristics influence breastfeeding more strongly for first-time mothers than multiparous women. The authors used the Pregnancy Risk Assessment and Monitoring System survey data, which is called PRAMS, Phase 8, from 2016 to 2017, and analyzed mothers' responses to the supplemental question about parity. The question reads, before you got pregnant with your new baby, did you ever have another baby, any other babies who were born alive? Study variables were summarized then using weighted means and proportions, comparing them to parity. You thought that other study had a lot of people. Well, this study had a sample size after they took out the moms with incomplete data of 20,694 mothers.
Nice, that's good.
40% of respondents were first-time mothers, and 88% of the population had initiated breastfeeding. The first-time moms were more likely than the multips to initiate breastfeeding, but it was only 92% versus 86%. However, the first-time moms had a shorter duration of breastfeeding. Now, this was what was in the abstract, and I will tell you, I spent quite a while working on this, and then I got down to the bottom where I realized that this shorter duration of breastfeeding in the primates was less than a week different. So it was 12.1 versus 12.9 weeks.
Interesting. That was significant because of the large size.
Right. But in terms of clinical significance, I don't think that's very significant. So I want to keep that in mind as we go forward.
Mm-hmm.
On adjusted analysis, the variables that were more strongly associated with breastfeeding, the other variables, the socio-demographic variables, were more strongly associated with breastfeeding intention among the first-time moms than the mothers who were having their second or further children. And these were maternal age, educational attainment, receiving breastfeeding information from a nurse or other medical professional, and receiving breastfeeding information from family and friends. So the authors concluded that breastfeeding initiation is impacted more strongly by maternal characteristics for these first-time moms. And I found this fascinating because I find it to be true in my clinical work. I see a lot of moms who had either very positive or very negative breastfeeding experiences in the past, and that is what is most impactful in terms of their decisions going forward. So the authors remind us that success with breastfeeding after a previous birth increases mothers' likelihood of initiating and sustaining breastfeeding for subsequent children. However, multiparous women experience unique challenges, including caring for older children. Some studies have confirmed that multiparous women are less likely to initiate breastfeeding than first-time moms, and others have found no difference between the two groups. So there's definitely some conflict in the literature.
I think it probably depends on their other factors in terms of whether or not they will try again. You know, in other words, if a multiparous woman has a bad experience the first time, women who probably have higher education and more resourceful will seek out an antenatal lactation visit to understand what happened, what's going to happen next time, versus those who maybe were shell-shocked, didn't have enough support, had a horrible experience, like readmission for sepsis and a terrible abscess and, like something, terrible. And then they're just like, oh no, I'm not doing that again. They have some PTSD from that. So I don't know. I think it depends on so many different factors, because I tend to see so many women in my practice who not just my breastfeeding medicine practice, but my regular family medicine practice, who had trouble initially. And they're like, okay, I'm going to try again. I feel like I'm so much more educated. I understand things that I maybe could do better next time. I'm not going to give a bottle early. I'm going to pump early, like,
Yeah, no, absolutely. But Anne, those are your patients.
yeah,
And
this is
they
not,
are impacted by a physician who says it could be
oh,
different this
yeah,
time.
that's true. Right. You're correct. Yes.
And so I find that all the time, like so many of my patients, when I was in general peds practice, I just would often meet people who were coming to see me with their 2-year-old who just happened to be obviously pregnant. And I would be like, oh, and I moved around a lot. So I didn't usually know my patients for many years. I frequently hadn't taken care of them when they breastfed their first child. I'd be like, oh, how did breastfeeding go with your first child? And they would be like, bad. I'd be like,
Yeah.
well, tell me about it. And, did you know that we could blah, blah, blah. And I would have such a wonderful experience when I supported them with breastfeeding. And they were like, it was so different. It went great. As opposed to those moms who encounter a healthcare provider who, maybe they don't even think breastfeeding didn't go that great. Like they sort of weaned around 4 months because things were not going so great. And then somebody's like, okay, doesn't even ask them how they're going to feed their next child.
Right, right. Yeah, I do think more and more studies are showing the importance of support from their healthcare provider, from a nurse in the office, or even the medical assistant, the physician, that they seem to care. And, I think if they recognize that the healthcare provider sees this as valuable and that this is important for the health of their infant, and even though they're probably not talking to the mother about her own health, which of course is very important, that may, I totally understand how that can make a difference. We definitely need to everyone needs to own this, right? We all need to own it. It shouldn't be shoved off to the community lactation consultant or to the Leche League. And obviously they're there for support, but healthcare providers need to be involved as well, for sure.
Absolutely.
Yeah.
Anyway, I think for those people who are interested in this study, there's a lot in the discussion about like one of the things you were just mentioning. It's the association between receiving breastfeeding information from nurses, midwives, or lactation consultants remain the strongest predictor of breastfeeding initiation among multiparous, even though association was weaker among first-time moms. And that indicates an opportunity to optimize this communication. And that association was even stronger than information given by physicians to that group. And they hypothesized that, this may have to do with the time that was spent and the, knowledge that was given from those people who were focused on that. So
I would say that I think there's a fair amount, I think there's a difference in trust, quite honestly. Like, I think people have a sense that healthcare providers withhold information. So, and so I don't know if you've ever had this experience. This happens a lot in like adult medicine, where the medical assistant or the nurse will come in and help the person in the room, like take their blood pressure and their pulse, and then say, oh, your blood pressure is kind of low today. You feel okay? And their blood pressure may be normal, like 90 over 60, which is normal for a young, healthy person. And they'll be like, yeah, I feel okay. And then they're like, okay. And then they leave the room and the doctor comes in and the patient says, oh, is my blood pressure low? And the doctor's like, no, your blood pressure is great. And then they're like, And they always have in the back of their mind that person said that their blood pressure was low. And then they're worried that the doctor's like not paying any attention to it, or not, like, doctors can be so cavalier, And
yeah, no, for sure. They specifically called out in this that they were like, even when doctors had gone over things, the patients like didn't like remember it. And it's so interesting, like
yeah,
the
yeah,
number of things that we're covering and the things that stand out for us and the way that we highlight those or we don't.
yeah. Yeah. So we have a strict rule, like, medical assistants cannot make comments about, well, they're not diagnosticians anyway, but they
Well,
can't.
sure. It's like when somebody's doing your ultrasound and they're, they're not supposed to tell you what they see while they're doing your ultrasound.
Right.
And if they, see something giant, like, first of all, it's just going to freak you out. But it's really off-putting to be having somebody who clearly does this every day and has a good clue what they're looking at be like, oh, I can't tell you anything. Goodbye. And
Yeah.
then having to wait for days.
Or they furrow their eyebrow and they, let me get the doctor, and then the doctor looks and goes, well, your primary will get back to you.
Yeah.
And the patient's freaking out.
Yeah, I mean, I had to go for an ultrasound a while ago, and I was just like, the number of things that she was clicking and doing measurements on the screen, I mean, it was like 5,000 shots. I was like, clearly I'm dying.
Or you have quadruplets.
I mean, I think partly it's just the hypochondriac doctor inside of me.
Oh, absolutely. But we all pick up on those little signals, right? Those little like gestures that person's doing, their level of concern, how they say, oh, okay, well, you're all done now, as opposed to, okay, you're done. They'll call you.
Okay, wait. I found one of the parts I was looking for. It said, of these factors, receiving breastfeeding information from nurses, midwives, or lactation consultants was associated with an 8-fold increase in the odds of breastfeeding initiation in first-time mothers and a 4-fold increase for multiparous mothers.
Interesting.
And so, I think it's just fascinating because it really highlights between these two studies that there's a lot that we don't know. And even if you were to combine the two, right? Like in the second study, I was like, oh, if this study was done only looking at moms who had been successful for at least 2 months, I wonder how the data would be different than looking at all moms and including the ones who, gave up at day 3 because their nipples were bleeding and they were just not gonna continue.
Yeah.
So it's really hard for me to understand, and that's why I keep reading all these studies, all of the differences in the populations, and then, from what I see when I'm just taking care of one mom, and how we can make the healthcare system better for all the moms.
Yes. Yeah. I think also there are some definite individual characteristics that mothers have, personality-wise.
Oh, God, yes.
Yeah, that people who are very, very anxious, I feel, have a harder time kind of going to the flow, so to speak.
I saw this mom on Thursday who was really struggling. She'd seen like 5 or 6 outpatient lactation consultants, and she came to see me. And she was one of these moms that when she held her baby to nurse, just was in the most awkward position. The baby looked unsettled. She looked uncomfortable. And like, if you just looked at the mouth, the baby's latch looked fine. And she's like, they keep telling me the latch looks fine, but I'm having a lot of pain. And, there's a lot going on, but the level of anxiety that she had about this baby's reflux, and he had to be completely vertical while she was feeding him because she was worried about his reflux, and he was like a completely normal, fat, happy baby who could not tolerate any amount of crying. And I think we really see that in every day. There's, my nurse practitioner likes to say, they're crying, not dying, because she's got 4 kids, and babies cry, and sometimes we see families are changing the diaper and the baby's screaming, and everybody's fine. It's going to be done in a second. No worries. And then you see people who are just like freaking out. Where's the passy? Mom and dad are both right there shushing them. And
and you see that too when the kids are older too, when they come in with the 2-year-old, and the 2-year-old interrupts like every minute of the conversation, and then they will respond and talk to them and say, try to, just continue to talk to them to address what they're saying to them. And so the 2-year-old has complete control over the mother, or over the father too, sometimes a little less over the father than the mother oftentimes, but some of that is anxiety too. And so there's a learned behavior there that starts early.
Well, and I think I see a lot more of it now, even just in these few months, because the normal support that families have is missing. And, being able to go to those mom groups and be around other people and see what other people's babies are like. And it's really, really hard.
Yeah, very hard. Absolutely. Yeah. But I think parenting blogs, I mean, that's kind of cool. That's a good thing to share with your families.
Yeah, I wish I had known now. I wish I knew then what I know now about, toddlers. My kids are big, and I'm like, oh,
Yeah. Yeah. I think that would have helped me a lot to be part of a parenting blog when my kids were little. But
The
that was,
problem is you don't have time to read anything when your kids are really little.
that's true. Oh my gosh, that is so true. Yeah.
Some of the people who come in who clearly have been up all night on the internet, and I'm like, just turn it off.
Yeah, definitely. All right. Well, that's interesting. I think for those of us who are listening, thinking a lot more about intention and support when you're helping mothers, can maybe give a different light, like a different lens for these people, and trying to understand, what their socioeconomic / social support / healthcare support system is like, to understand, that those factors that's going to lead them to stay with breastfeeding or quit, and also their behavioral characteristics as well.
Yeah.
Complex. All right. Well, Karen, it's really great talking to you, and I hope things go well for you, for your hospital system, for your family.
Oh, same to you. Stay healthy.
Yeah, you too. Take care.
Bye.
Bye.
For questions regarding this podcast, please contact us through our website at lacted.org. We have other educational projects, including the Clinical Question of the Week, our Little Green Book of Breastfeeding Management for Physicians, and our various educational courses and conferences for physicians and other breastfeeding supporters. If you want to see what we look like, check out our Breastfeeding Medicine podcast Facebook page, where you can post any questions or comments about our podcasts. Thanks for listening, and we'll be back with you in about 4 weeks.